Welcome to Pindar Poetry. We hope you learned something new.
You start by removing the mismatch between your eyes and inner ear. Sit facing forward, fix your gaze on the horizon, and avoid reading. This reduces sensory conflict quickly. Next, get cool air on your face and slow your breathing to a calm 6-8 breaths per minute to lower nausea. Finally, take anti-nausea measures. Chew ginger or take an over-the-counter 1/2 dose if you normally tolerate it. These actions work together to drop symptoms within 10-20 minutes. Once initial nausea eases, stabilize your physiology to prevent a rebound. Make sure your head is supported and still. A neck brace or padded rest keeps vestibular signals consistent and reduces vomiting risk. Sip cool, clear fluids slowly to maintain hydration without upsetting the stomach, and avoid greasy or acidic foods. If you use acupressure, press the P6 point on the wrist or wear a C-band for 15-30 minutes. This can blunt nausea signals without medication. Move on. To finish, get up very slowly. Sit for a minute, then stand and test balance for 1-2 minutes before walking. This prevents recurrence from sudden positional changes. If nausea or dizziness persists beyond about 1 hour despite these measures, use a prescribed antiemetic or contact a clinician. Prolonged symptoms can signal dehydration or vestibular issues. Troubleshooting tip: if vision changes, severe vertigo, fainting, or chest pain appear, lie flat. Keep airway open and seek immediate medical attention. Those are red flags.
Thanks for watching. Consider subscribing if we helped you.